Think your kidneys are invincible? Think again. Your kidneys are vital organs that perform a multitude of essential functions. They filter waste products and excess fluids from your blood, regulate blood pressure, balance electrolytes, and produce hormones that affect other organs. Despite their importance, many people take their kidneys for granted until something goes wrong. Understanding the causes of kidney problems can help you take proactive steps to protect these crucial organs. Here's why they might be at risk. First up, diabetes. Diabetes is a major risk factor for kidney disease. When blood sugar levels are consistently high, it can cause damage to the blood vessels in the kidneys. This condition, known as diabetic nephropathy, is one of the leading causes of kidney failure. Managing your blood sugar levels through diet, exercise, and medication is crucial to prevent this type of damage. High blood sugar can damage those tiny filters in your kidneys. These filters, called glomeruli, are responsible for removing waste and excess substances from your blood. When they are damaged, your kidneys can't function properly, leading to a buildup of waste products in your body. Over time, this can result in chronic kidney disease or even kidney failure. Regular monitoring of blood sugar levels and maintaining a healthy lifestyle are key to protecting your kidneys from the harmful effects of diabetes. High blood pressure puts a lot of strain on those little guys. Hypertension, or high blood pressure, is another significant risk factor for kidney disease. When your blood pressure is too high, it can damage the blood vessels in your kidneys, reducing their ability to filter waste effectively. This can lead to a condition called hypertensive nephropathy. Controlling your blood pressure through lifestyle changes and medication can help prevent this type of kidney damage. Bacterial invasions like UTIs can travel up to your kidneys, causing trouble. Urinary tract infections, UTIs, are common, but if left untreated, they can spread to the kidneys and cause a more serious infection called pyelonephritis. Symptoms of a kidney infection include fever, chills, back pain, and nausea. Prompt treatment with antibiotics is essential to prevent permanent kidney damage. Practicing good hygiene and staying hydrated can help reduce the risk of UTIs and subsequent kidney infections. Ouch! These hard deposits can block the urinary tract. Kidney stones are solid masses made of crystals that originate in your kidneys. They can cause severe pain, especially when they move through the urinary tract. Factors that increase the risk of developing kidney stones include dehydration, certain diets, obesity, and some medical conditions. Drinking plenty of water, maintaining a healthy diet, and managing underlying health issues can help prevent the formation of kidney stones. Last but not least, chronic kidney disease. Chronic kidney disease, CKD, is a long-term condition where the kidneys gradually lose function over time. It can be caused by a variety of factors, including diabetes, high blood pressure, and recurrent kidney infections. CKD often progresses silently, with few symptoms in the early stages. Regular checkups and blood tests can help detect CKD early, allowing for timely intervention to slow its progression. Often silent, but slowly damaging. Prevention is key. Early detection and management of risk factors are crucial in preventing chronic kidney disease. This includes controlling blood sugar and blood pressure, maintaining a healthy weight, avoiding excessive use of medications that can harm the kidneys, and staying hydrated. Lifestyle changes such as eating a balanced diet, exercising regularly, and avoiding smoking can also play a significant role in kidney health. Keep your blood sugar and blood pressure in check. Regular monitoring and management of these parameters can significantly reduce the risk of kidney damage. Work with your healthcare provider to develop a plan that includes medication, lifestyle changes, and regular checkups to keep your kidneys functioning optimally. Stay hydrated and watch out for warning signs. Drinking enough water helps your kidneys remove waste from your blood and maintain the body's fluid balance. Aim for at least 8 glasses of water a day, but adjust based on your activity level and climate. Be aware of symptoms such as swelling, fatigue, changes in urination, and persistent pain, and seek medical advice if you experience any of these signs. Your kidneys work hard for you. Let's keep them healthy. By understanding the causes of kidney problems and taking proactive steps to prevent them, you can protect your kidneys and ensure they continue to function effectively. Regular checkups, a healthy lifestyle, and prompt treatment of any issues can go a long way in maintaining kidney health. Like and subscribe for more. Stay informed and take charge of your health by following our channel for more tips and information on maintaining kidney health and overall well-being. Now that we've covered what causes kidney problems, Let's move on to the symptoms you should watch out for. Recognizing these signs early can make a huge difference in managing kidney issues effectively. First up, changes in urination patterns. If you notice that you're urinating more frequently, especially at night, or if the color of your urine changes dramatically, it could be a sign that your kidneys are not functioning properly. Pay attention to any unusual smells or foamy urine as well. Next, swelling in different parts of your body. Your kidneys help balance the fluids in your body, so when they aren't working well, you might experience swelling in your legs, ankles, feet, or even your face and hands. This is due to fluid retention, as your kidneys can't remove excess fluids efficiently. Fatigue and general weakness are also common symptoms. Healthy kidneys produce a hormone called erythropoietin, which helps your body create red blood cells. When kidney function declines, this hormone decreases, leading to anemia and the feeling of fatigue. Persistent back pain or flank pain can indicate kidney problems as well. This pain is usually felt on one side, just below the rib cage, and can radiate to the lower abdomen or groin. If you experience this type of pain, it's important to seek medical advice promptly. Nausea and vomiting are signs that waste products are building up in your body because your kidneys aren't filtering them out properly. This can lead to a loss of appetite and weight loss. Shortness of breath can occur because of fluid buildup in your lungs or anemia caused by kidney disease. If you find it difficult to catch your breath, especially during physical activities, it could be a sign that your kidneys are struggling. Lastly, high blood pressure can be both a cause and a symptom of kidney problems. When your kidneys aren't working well, they can't regulate your blood pressure effectively, leading to hypertension. Remember, early detection is key. If you notice any of these symptoms, consult with a healthcare professional to get the appropriate tests and treatments. Stay vigilant and proactive about your kidney health. Like and subscribe for more. Stay informed and take charge of your health by following our channel for more tips and information on maintaining kidney health and overall well-being. Now that we've discussed the causes and symptoms of kidney problems, it's crucial to understand how to prevent and treat them. Prevention is always better than cure, and there are several steps you can take to keep your kidneys healthy. First, maintain a balanced diet. Eating a diet rich in fruits, vegetables, whole grains, and lean proteins can help reduce the risk of kidney disease. Limit your intake of salt, sugar, and unhealthy fats. Staying hydrated is essential. Aim to drink plenty of water throughout the day to help your kidneys flush out toxins. Regular exercise is another key factor. Physical activity helps maintain a healthy weight, reduce blood pressure, and improve overall kidney function. Aim for at least 30 minutes of moderate exercise most days of the week. Avoid smoking and limit alcohol consumption. Both smoking and excessive drinking can damage your kidneys and increase the risk of kidney disease. If you smoke, seek help to quit, and if you drink, do so in moderation. Monitoring your blood pressure and blood sugar levels is vital. High blood pressure and diabetes are leading causes of kidney disease. Regular checkups with your healthcare provider can help you keep these conditions under control and prevent kidney damage. If you have existing kidney problems or are at high risk, follow your doctor's advice and take prescribed medications as directed. Early treatment can slow the progression of kidney disease and improve your quality of life. In some cases, lifestyle changes and medications may not be enough, and more intensive treatments like dialysis or a kidney transplant may be necessary. Dialysis is a procedure that helps remove waste products and excess fluids from your blood when your kidneys can no longer do so. A kidney transplant involves replacing your damaged kidney with a healthy one from a donor. Remember, early detection and proactive management are key to maintaining kidney health. By making simple lifestyle changes and staying informed, you can significantly reduce your risk of kidney problems. Thank you for watching. Don't forget to like, subscribe, and hit the notification bell to stay updated with more health tips and information. Stay healthy and take care of your kidneys.